Imagine this. You are 62 years old. You have been on Medicaid for the past 4 years. It covers your blood pressure medication. It covers your insulin. It covers the specialist you see every 3 months for your heart condition. Without it, you simply could not afford to stay healthy. One afternoon, you walk to your mailbox. There is a letter from your state Medicaid office. You open it, and it says you must verify 80 hours of qualifying activity per month or your coverage will end. You read it again. 80 hours. That is 20 hours every single week. You have bad knees. You left your last job 2 years ago because your body could not take it anymore. You are not lazy. You are not trying to cheat anyone. You are just trying to survive. And now the government is saying, prove you are working or lose your health insurance. Here is what I need you to understand right now. This is not a rumor. This is not a political debate. This is already signed federal law. And the deadlines are approaching faster than most people realize. Stay with me, because by the end of this video, you are going to know exactly what this law says, exactly who it affects, and exactly what you need to do before June to make sure your coverage stays intact. I am Edward. I am a senior policy analyst and retirement finance expert. And this channel, Global Senior Alerts Official, exists for one reason: to make sure that you understand the rules affecting your benefits before those rules catch you completely off guard. Because here is what I have learned after years of researching these policies. The rules are not written to be easy to understand. The deadlines are buried in government documents, and the people who are most affected, seniors and near retirees between 50 and 64 years old living on modest incomes, are almost always the last ones to find out when something changes. That ends today. In this video, I am going to walk you through the new federal law that is already affecting millions of Americans. I am going to explain the Medicaid work requirement, the SNAP work requirement expansion, the key exemptions that could protect you, and the exact steps you need to take right now. But I need you to stay until the end, because there is a hidden trap buried inside this law that almost no one is talking about. A trap that can cause you to lose not just your Medicaid, but your ACA health insurance subsidy at the exact same time. And once that happens, most people have no affordable options left. Let me start with a story. I want to tell you about Margaret. Margaret is 61 years old. She lives in a mid-sized city in Ohio. She worked for 28 years as a retail store manager. She was good at her job. She took pride in it. But 3 years ago, her knees gave out. Severe osteoarthritis in both joints. Standing for 8 hours a day was no longer possible. She had to leave her job. Her income now comes from a small savings account and a modest early pension, about $18,000 a year. She qualifies for Medicaid through Ohio's ACA expansion. She also receives SNAP benefits, about $200 a month, that help her cover groceries. Margaret heard about the new work requirement law on the news one evening. She listened for a few minutes, and then she turned the channel. Because she thought to herself, I have bad knees. I cannot work. They are going to leave me alone. That thought cost her everything. Here is what Margaret did not know. She did not know that her knee condition does not automatically make her exempt. The law requires formal classification as medically frail, a written statement from her doctor describing her condition and how it limits her ability to work, submitted directly to the Ohio Medicaid agency. Margaret never filed that paperwork. She did not know that the SNAP work requirement for people her age, 61, was already active as of November 1st, 2025. When a letter arrived from her SNAP office in December, she assumed it was routine and set it on the counter without reading it closely. She never responded, and she did not know about the hidden trap. She assumed that if she lost Medicaid, she could simply go to the ACA marketplace and get a subsidized plan. She cannot. Under federal law, if you lose Medicaid specifically because you failed to meet the work requirement, you are not eligible for ACA premium tax credits. That is written directly into the law. It is not an error. It is not something she can appeal her way around. So Margaret lost Medicaid. She lost her SNAP benefits, and she discovered she could not afford marketplace coverage without the subsidy. Plans for a 61-year-old without assistance run $800 to $1,200 a month. She is now uninsured. With bad knees, with a heart condition, with 5 daily medications she can no longer afford. Margaret's story is fictional, but every single rule that trapped her is completely real. And the Kaiser Family Foundation estimates that 1.7 million people between the ages of 50 and 64 are in Margaret's exact situation right now, at risk, without realizing it, and running out of time to act. Let me now give you the complete facts. Everything I am about to share comes directly from official government sources and verified research organizations, the Centers for Medicare and Medicaid Services, the Social Security Administration, the IRS, AARP, and the Kaiser Family Foundation. No speculation, no rumors, just the official rules explained in plain language. The law, what was actually signed. On July 4, 2025, the One Big Beautiful Bill Act, officially House Resolution 1, was signed into federal law. This law did 2 major things that directly affect seniors and near retirees between 50 and 64 years old. First, it created for the first time in American history a nationwide mandatory Medicaid work requirement. Second, it expanded existing SNAP work requirements to cover adults up to age 64. Let me take each one separately. The Medicaid work requirement, the exact rule. If you are a non-disabled adult between the ages of 19 and 64 and you receive Medicaid through your state's ACA expansion, meaning your income is at or below 138% of the federal poverty level, which is approximately $21,597 a year for a single person in 2026, you must now complete 80 hours per month of qualifying activities. 80 hours. That is 20 hours every week. Qualifying activities include paid employment, job training, vocational education, community service, volunteering, or enrollment in an approved educational program. 41 states plus Washington, D.C. have expanded Medicaid. More than 20 million Americans are enrolled under that expansion. According to the Kaiser Family Foundation, approximately 18.5 million of those people will be subject to these new requirements each year. The Congressional Budget Office projects that 5.3 million people will lose Medicaid coverage as a direct result of this single provision, and AARP reports that approximately 1.7 million of those at highest risk are adults between the ages of 50 and 64. 2 out of 3 of those people have 3 or more chronic health conditions. 1 in 5 takes 5 or more prescription medications every single day. Who is exempt, and the critical detail you must understand. You are exempt from the Medicaid work requirement if you are a parent or guardian of a child age 13 or younger. You are exempt if you are pregnant or in the postpartum period. You are exempt if you are classified as medically frail, which includes being blind, having a disability, receiving substance use disorder treatment, or having a serious mental or physical health condition documented by a licensed medical provider. You are also exempt if you are serving as a caregiver for a person with a disability. But here is the detail that is catching thousands of people completely off guard. These exemptions are not automatic. Having the condition is not enough. You must obtain written documentation from a licensed medical provider, a letter that specifically describes your condition and explains how it limits your ability to complete 80 hours of activity per month. That documentation must be submitted to your state Medicaid agency and accepted on file, and it must be renewed at least every 6 months. If the paperwork is not filed and accepted, the state system has no record of your exemption. As far as the computer is concerned, you are subject to enforcement. When your state sends a notice of potential non-compliance, you have exactly 30 days to respond with your documentation. If that window closes without a response, for any reason, your coverage terminates automatically. No further warning, no extension. It simply ends. The SNAP work requirement already in effect. Now let me talk about SNAP, because this part cannot wait until 2027. It is already happening right now. SNAP, the Supplemental Nutrition Assistance Program, previously required work compliance for able-bodied adults without dependents up to age 49. In 2024, that cap was raised to 54, and effective November 1st, 2025, the work requirement now applies to adults ages 55 through 64. The requirement is the same: 80 hours per month, 20 hours per week of work, job training, or volunteering. And you need documentation every single month. Pay stubs if you are working, timesheets or signed verification from a volunteer coordinator if you are volunteering. AARP estimates that approximately 3 million people could lose SNAP benefits because of this expansion, and exemptions that previously protected veterans and people experiencing homelessness have been narrowed or eliminated under the new law. If you are between 55 and 64 and you receive SNAP, this rule is not coming. It is already here. It has been since November 1st. If you have not addressed this, you need to act today. The hidden trap: losing ACA subsidies at the same time. Now I want to explain the hidden trap that caught Margaret in our story, because this is the piece that most people do not realize until it is far too late. Under current federal law, specifically the IRS rules governing the Affordable Care Act premium tax credit, if you lose Medicaid because you failed to meet the work requirement, you are not eligible for premium tax credits on the ACA health insurance marketplace. This is not a glitch. This is not a temporary policy. It is written directly into the law. Lose Medicaid through work requirement non-compliance, and you simultaneously lose your ability to get a subsidized marketplace plan as a backup. A 62-year-old earning $18,000 a year, well within the Medicaid eligibility range, who loses coverage this way would face full unsubsidized marketplace premiums averaging $800 to $1,200 a month. That is $9,000 to $14,400 a year on an income of $18,000. The math simply does not work for most people. They end up uninsured. The Social Security earnings test: the third layer of risk. Now, some of you watching this are thinking, I will just pick up a part-time job. 20 hours a week to meet the 80-hour requirement. That sounds like a reasonable solution, and it might be. But if you are collecting Social Security retirement benefits before your full retirement age, there is one more rule you need to understand first. In 2026, the Social Security annual earnings limit for people collecting before full retirement age is $24,480. If your earnings go above that threshold, SSA withholds $1 of your Social Security benefit for every $2 you earn above the limit. Let me give you a concrete example. If you work 20 hours a week at $15 an hour, you earn about $15,600 a year. You are well under the limit. Safe. But if you work at $25 an hour, perhaps in a skilled trade or an administrative role, your annual earnings hit $26,000. That is $1,520 above the limit. SSA withholds $760 of your Social Security benefit that year. The withheld money is not lost forever. SSA recalculates your benefit at full retirement age and credits it back. But in the short term, your monthly income drops. And for someone already managing a tight budget, that matters. Run those numbers before you commit to any work arrangement. Make sure the math actually works in your favor. The key dates written down right now. Let me give you the timeline one more time. These are the dates that matter. November 1st, 2025. The SNAP work requirement expanded to adults ages 55 through 64, already in effect. June 1st, 2026. HHS must publish the detailed federal regulations governing Medicaid work requirements. Less than weeks away. Once this rule publishes, state enforcement systems begin building immediately. January 1st, 2027. States must begin enforcing Medicaid work requirements. Some states, including Nebraska and Montana, have already announced earlier timelines for spring and summer of 2026, January 2027. Retroactive Medicaid coverage narrows to 1 month for expansion populations, down from 3 months. If you delay enrollment after a qualifying event, far fewer past expenses will be covered. October 2028. New Medicaid cost sharing begins, up to $35 per month for enrollees at the top of the eligibility range. The window to prepare is right now, not next year. Now. All right, you have heard the rules, you know the stakes. Now let me give you exactly what to do. 3 steps. Clear, specific, starting today. Step 1. Determine your exemption status and get it documented before June. If you are on Medicaid and you are between the ages of 19 and 64, your first task is to find out whether you qualify for an exemption and then get that exemption officially documented and on file. Go to benefits.gov benefit 1640 or call your state Medicaid office directly. Ask them one clear question. Am I likely to qualify for an exemption under the new federal work requirement? If you have a chronic condition, arthritis, diabetes, heart disease, a mental health diagnosis, any condition that limits your ability to work 20 hours a week, you may qualify as medically frail, but you need your doctor to write a letter. That letter must specifically describe your condition and explain how it prevents or limits your ability to complete 80 hours of activity per month. Generic medical records are not enough. A targeted, specific letter is what the state system needs. Submit that letter to your state Medicaid agency. Follow up to confirm they received it and have it on file. Set a reminder to renew it every 6 months. If you are caring for a child under 14 or an adult with a documented disability, you may qualify under the caregiver exemption. The process is the same. Documentation submitted and accepted in writing. Do this before June 1st, before the federal rule publishes and state systems begin their enforcement processes. The earlier you have documentation on file, the safer you are. Step 2. Address your SNAP compliance right now, not next month. If you are between 55 and 64 and you receive SNAP, the work requirement is already active. There is no grace period. There is no waiting until 2027. This is happening now. Every single month, you need documentation of your qualifying activity. If you are working, keep your pay stubs. Everyone. If you are in a job training program, keep your enrollment records. If you volunteer at a food bank, a church, a library, a community garden, anywhere, ask your supervisor to sign a monthly verification form confirming your hours and your role. That documentation goes to your local SNAP office. Do not assume they already have it. Confirm it. If you qualify for a medical exemption from SNAP as well, get that documented the same way. A written letter from your provider on file with your local SNAP office. You can find your nearest SNAP office at fnsusda.gov SNAP on State Directory. AARP also has a step-by-step guide on meeting the SNAP work requirement at aarp.org. I will link both in the description below. And if your SNAP benefits are reduced or terminated, know that you have the right to request a fair hearing. You have 90 days from the adverse action to file, and if you file within 10 days of the notice, your benefits must continue at their prior level while the hearing is processed. Do not walk away without exercising that right. Step 3. Check your Social Security earnings exposure before you commit to any work. If you decide that working part-time is your path to meeting the Medicaid or SNAP requirement, do not start that job until you have run your numbers. Go to ssa.gov My Account and check your current benefit amount and your full retirement age. Then go to the SSA Retirement Earnings Test Calculator at ssa.gov Benefits Retirement Planner while working.html. Enter your projected earnings and see whether you will cross the $24,480 annual threshold. For many people, the math will still work out. Keeping Medicaid and SNAP may be worth significantly more than a temporary reduction in your Social Security check. But you need to know your specific numbers before you commit, not after you have already started working and received a reduced deposit. And one more resource I want to make sure you know about. If you need free personalized guidance on any of this, whether it is the Medicaid work requirement, the SNAP rules, the ACA subsidy question, or the Social Security earnings test, contact SHIP, the State Health Insurance Assistance Program. Free counseling, no sales, no judgment, just knowledgeable people whose entire job is to help you navigate exactly these situations. You can reach them at shiphelp.org or by calling 1-800-MEDICARE, which is 1-800-633-4227. The Consumer Financial Protection Bureau also has a free retirement planning tool at consumerfinance.gov, Consumer Tools, retirement that walks through benefit interactions and financial decisions for older adults. I will link that below as well. Before I let you go, I want to say something directly to you. The rules I described in this video are complicated. They are layered on top of each other in ways that are genuinely difficult to navigate. Medicaid connects to ACA. ACA connects to the IRS. Part-time work connects to Social Security. And one missed letter, one 30-day window that closes without a response, can trigger a chain reaction that leaves someone completely without health coverage. That is not an accident. Complex systems with short deadlines and buried exemption requirements will always catch the most vulnerable people first. And seniors between 50 and 64, people who worked their whole lives, who paid into these systems, who did everything right, deserve better than that. You cannot control what Congress passes, but you can control whether you are prepared. And today, right now, you are more prepared than 90% of the people affected by this law. Because you know what the rule says, you know the exemptions, you know the deadlines, and you know the 3 steps to take right now. Use that. Share this video today with someone you care about who is on Medicaid or SNAP, a parent, a sibling, a neighbor, a friend at church, anyone between the ages of 50 and 64 who might not know this rule exists. They need to see this before June, not after. And I need to be honest with you about something. YouTube is unpredictable. The algorithm decides what shows up in your feed. Notifications do not always come through. A major rule change can happen, one that directly affects your health coverage or your food assistance, and you might not see a video about it for weeks, or you might never see it at all. That is a real risk, and I have built something to protect you from it. Click the link in the description right now and join the Global Senior Alerts official WhatsApp channel. When you join, you will be able to immediately download a completely free Senior Benefits Protection Guide. This guide covers Medicaid, SNAP, Social Security rules, Medicare enrollment, ACA subsidies, overpayment rights, pension regulations, and more. All written in plain, clear language that you can actually use. You will also receive real-time alerts sent directly to your phone the moment a major rule change happens that affects your benefits. Not a week later, right when it matters, so you have time to act before a deadline closes. No spam, no sales pitches, no political commentary, just the facts you need the moment you need them. Because here is what I know after years of doing this work. The seniors who protect their benefits are not the ones who are luckier or smarter. They are the ones who got the right information at the right time and used it. That is the only difference. And that is exactly what I am here to give you. The SNAP work rule for ages 55 to 64 is already in effect. The federal Medicaid regulation publishes June 1st. State enforcement begins January 1st, 2027. Some states are starting earlier. The window to protect yourself is right now. This week, today. I am Edward. Thank you for watching. Thank you for trusting this channel with your time. Please subscribe if you have not already. Turn on notifications. Share this video with someone who needs it. And I will see you in the next one. Take care of yourself. You have earned that.